A very good evening to all of you. Today we are going to do the MCQ challenge of orthopedics. Orthopedics has 10 to 12 questions in its credit. So please master this subject as far as possible. So let's begin with the first question. Identify the instrument. Well, it is a rail fixator. Identify the given splint. Well, it is a cock-up splint. Cock-up splint can be used in wrist pain, De Quervain's disease, Colles fracture, and carpal tunnel syndrome, wrist drop, and hemiplegia. A football player fell on outstretched hand while kicking the ball and felt pain at the wrist joint immediately after falling. Identify the fracture. Look at it carefully. Well, it is a Cagliacci fracture. What is the use of given instrument? It is used to hold the bone and plate. It is a plate holding forceps. Earliest sign of compartment syndrome of leg is A. To tingling or numbness, B. Skin mottling, pulselessness, pain or passive stage. It is pain or passive stage. What is the most common sequelae of traumatic shoulder dislocation in young adults? It is recurrent shoulder dislocation. In the fracture seen in the figure, what is the most commonly expected vascular injury? It is brachiolateral. What is the eponym of fracture shown below? It is Monteggia fracture. An athlete suffers a fracture shown in the knee X-ray below. What is? Do the tension band vary? Which part of second metatarsal is involved in March fracture? Head, neck, shaft. It is a neck is involved. Which of the following is incorrect about PCL? It is a main restraint to internal rotation. It is incorrect. About giant cell tumor, all are true except osteoclast giant cells constitute the proliferative component of tumor is false. What is the diagnosis? Well, it is a giant cell tumor. Identify the deformity. It is swan neck deformity seen in rheumatoid arthritis. Glucosamine supplementation is given in arthritis. Patellar clunk syndrome is presented. Superior polar petal impinging on the femoral component of extension. It is femoral component during extension. Most specific for diagnosing ankylosing spondylitis is bilateral sacroiliitis. What is the most likely cause of abnormality seen in wrist X-ray as mentioned below? Rickets. 75-year-old female fall and had an intertrochanteric fracture is due to osteoporosis. 55-year-old male patient presents with severe backache, for 10 days, urinary incontinence, history of intervertebral disc prolapse, there is history of fever and weight loss. What is the diagnosis? It is Koda-Ikola syndrome. All of the following are true about springal shoulder. Associated diastole most commonly associated with Klippel-Feil syndrome, usually associated with dextrocardia. Usually associated with dextrocardia is false. What is the likely diagnosis image given? Coxa magna, coxa magna, coxa vara, coxa. It is coxa vara. Meralgia paresthetica, most often repeated MCQ, lateral midcutaneous nerve of thigh. Identify the deformity given in the picture. It is hallux valgus. Haglund's deformity is seen in which joint? It is seen in the ankle joint.